Joining me now is Dr. Grossman, Executive Medical Director with Hoag Family Cancer Institute. I'm so excited. This is such an important discussion that we're going to have, and everybody, nobody wants it, but unfortunately people get it. So we're here to discuss Hoag's comprehensive cancer care. Dr. Grossman, welcome to the show.
Thanks, Bree. Really glad to be here.
Pleasure to have you. Again,
Wonderful.
It's kind of a tough topic, but yeah. I think that you can help take some of the mystique out of it and tell us
Sure.
exactly what's going on over there at Hoag.
Love to.
Let's talk about you for a second.
Okay.
Give us a little bit about your background and your history.
Okay. I've been in California for all of 5 years, but previous to that, I grew up on the East Coast in Long Island, New York area. Went to college at Princeton University, and medical school at University of Chicago, and did the rest of my medical training, including my cancer training in Boston at Dana-Farber Cancer Institute. Mm-hmm. And then after having a few faculty positions on the East Coast, I came out to USC about 5 years ago to the Norris Cancer Center, where I was physician-in-chief until about 2 months ago. And then I found my way here to the Hoag Family Cancer Institute right in the middle of April. And I couldn't be more excited about being here.
Wow. Well,
yeah.
That's a fun transition.
Who
doesn't love Orange County, right?
I love Orange County. I've really been enjoying just the past 2 months of living here and getting to know the community and the beautiful nature that's around everywhere. So it's all great.
Fantastic.
And what's really great is what we're doing at the Cancer Institute. So let's talk about it.
Yes, we will. We will. What made you sort of zero in on cancer?
Gosh. I'm also a cancer researcher, a cancer scientist. I try to find new cures or new treatments for cancer, and that all started a long time ago when I got a PhD in what was called molecular genetics. But back then, my research was in understanding how the HPV, the human papillomavirus, causes cervical cancer. And after that, I was hooked. And so
Really?
I've been doing cancer research and taking care of cancer patients ever since.
Wow. Well, we're certainly lucky to have your brain exploring. So what would you like the audience to know about the Hoag Family Cancer Institute?
Well, the Hoag Family Cancer Institute is where you can come and at least have the assurance you're going to get the best care that you can get anywhere. And not only that, we're going to wrap our arms around you and provide that holistic and truly compassionate care that only a health system like Hoag, which is really based in the community, can provide. Mm-hmm. But at the same time, we're providing cutting-edge treatments, clinical trials, over 100 or about 100 clinical trials, not unlike you would see at some of the larger cancer centers in the Southern California area. Advanced surgical techniques, we're a center of excellence for robotic surgery. That's the sort of a minimally invasive types of surgery. And we also offer multidisciplinary care. So it's not just you see one doctor at a time, you can see all of the doctors at a time who you'll need for your care. Certain cancers need surgery and radiation, and someone like me, a medical oncologist. So all of our doctors are there in the Institute and can provide all of the cutting-edge care that you need in a very coordinated fashion. That's what we're all about.
You know, I can speak to this firsthand. One of my best friends was diagnosed, and within a time period of about 3 months, she had gone through all of her treatments, had the robotic surgery.
Yes.
Was released from the hospital 3 days early.
Great.
And she's doing wonderfully. She absolutely loved her doctor over there at Hoag. I went to see her and spent some time with her in her room. And, from beginning to end, and I did one of these, like, I hate hospitals. I don't even go near them.
Me too.
And it was just so welcoming, the whole experience. And I know that she absolutely trusted and felt extremely cared for by her doctor there at Hoag.
Fantastic. Well, Thank you. That was unsolicited, right? But
Well,
I appreciate it.
this
But
was
that's
just
what we
a couple
strive
months
for.
ago.
Yeah, that's in our DNA. That's in the water. All of us, because we provide. Obviously, we have the best doctors that you can find in Southern California or in the country, but we also have the best nurses and physician extenders or nurse practitioners and navigators who help coordinate all of that care. It's really we're a family that provides care for your family, I think is how we think of it.
And I think just to wrap up my brief story,
Yeah.
what I would like our viewers to know is the peace of mind that she had when she left. It was like, she was going into it just absolutely scared to death, crying constantly, to, being released 3 days early saying you have nothing to worry about anymore. But, of course, come in for your checkups.
Of course.
But she's vibrant, she's healthy, she's going to lunch with us again. I mean, and so she's got her life back without, the back of the mind, it likes to play little tricks on us and keeps us in that fear mode. And she just doesn't have that anymore.
Because she knows that we've got her back.
She felt like, her doctor was kind of her mom.
Oh,
so
that's great.
So
Well,
enough on that.
Yeah.
But I just wanted everybody to know it does definitely feel like it's family care.
Yeah, and there's nothing that look. I mean, cancer just shatters your world.
It
that
does.
when you get the
100%.
diagnosis, you, your friends, your family, and you, of course, are all sucked into this vortex, and it's our job to put you at ease.
Right. Not
And-
only to
and
know
treat
everything
you.
about it and all
Yeah.
the research you guys are doing. So tell us about some of these clinical trials.
Absolutely. So what Hoag has decided to do, Hoag has historically provided care to this Orange County community since around 1950. Absolute best medical care you can get anywhere. But some years ago, they also decided they were going to provide access to the types of cutting edge research that normally you might expect to find at larger, if you want to call them academic centers, universities and so forth. Mm-hmm. And they have invested heavily in building a clinical trials program and bringing in doctors, faculty, like myself, who have contacts all across the country or the world with pharmaceutical companies and other universities to bring in the best and most innovative care, which comes in the form of clinical trials. And that's where we're testing something, and it's a very specialized thing, and it requires quite a substantial investment. And right now, we have about 100 clinical trials for different kinds of cancer available right now in the Institute. So, in many cases, I'll just really briefly, for breast cancer or colon cancer, there may be some standard treatments that you get along the way, chemotherapy, things that will work most of the time, but if they don't, we have the backup. We have those clinical trials to say, well, if this didn't work, now this is the latest research, and we can offer it to you here at Hoag. You don't have to go anywhere else.
Wow, that's
Yeah,
incredible. So, doctor, are there new cancers developing that you're seeing, or is it the same standard type of cancers that have been with us for as long as we can remember?
Sure. Well, it is the same cancers, but what's happening is there's a change in the pattern or the incidence, meaning certain cancers are becoming more prominent, and others are actually kind of getting maybe a little better. And also there's some age changes in the age distribution, some younger people getting cancer. So to break it down really quick, we're seeing a lot more pancreatic cancer, and that's not good, because pancreatic cancer is really one of the harder ones to treat.
Do we know what causes that specifically?
Not really, we don't. We think it's a combination of what you inherited through your genetics, but exposures in what you eat in the food, or what we're exposed to in the water or the air, the environment. We're not sure. So there is that. But also we're seeing, unfortunately, younger people being diagnosed with cancer, especially breast cancer, uterine cancer, even pancreatic cancer, and colon cancer are now being found in younger people. And we need to understand why. But of course, we're here, and we're available to treat you if that happens.
And younger, meaning what would that demographic be, like 30s, 40s?
Well, definitely 30s, and unfortunately 20s even.
Oh.
I treated a 19-year-old with colon cancer a few years ago. Yeah,
Gosh.
which is just tragic. A lot of the symptoms that you associate with cancer, when you're older, you might think about it. If you're 19 and you have a belly pain, that cancer is the last thing in anybody's mind, including most doctors. So that's something we're looking at.
Yeah. So can people be proactive in sort of screening themselves, or what are some of the common things to look for? Absolutely.
Well, there's some very tried and true screening guidelines, whether you're a man or woman, which your primary care physician should be kind of holding you to. So at age 45, everybody should be starting their colon cancer screening, which is a colonoscopy, or some of the new tests like Hoag. And for women, mammograms, depending on your risk factors, sometime in the 35 to 40 range. And for men, prostate cancer is a decision with you and your doctor to be screened with the PSA, depending on some of your risk factors. So that's some of it. And lastly, of course, for a long time, cervical cancer is something we've screened for with pap smears, and that should continue. But there's a lot of work being done in the screening area for other cancers where there isn't sort of a standard yet, but it's coming soon.
My goodness.
Yeah.
Wow. So, Dr. Grossman, I understand Hoag is expanding.
Yes.
You have a lot to tell us about that.
Absolutely.
It's exciting.
Gosh, it is so exciting. On our Irvine campus, where we currently have our acute care hospital and clinics, including an oncology clinic, we're undergoing a $1 billion expansion of this Sun Family campus. And as part of that, we are putting in what's called a cancer and digestive health pavilion, which includes dedicated outpatient space, including infusion for cancer and GI diseases, and a separate hospital just for cancer and digestive diseases. That's going to be 60 beds. And it'll be a place, of course, our patients are well cared for in the hospital, as it is, but they'll get even more specialized care in this new 60-bed hospital. And it'll also provide space for us to expand some of our offerings in things like what are called cell therapy, which is some of the most advanced cancer therapies that are out there. Take cells out of the patient's blood, engineer it to kill the cancer, and put it back in the patient's blood.
Really?
And you need specialized spaces, both outpatient and inpatient, to do it. So that's going to be part of our newer offerings there, which we're already doing on a smaller scale, but we're going to really have some major offerings there. And lastly, there'll be a 24/7 urgent care for cancer right there in the pavilion. So instead
Has that been done before?
Very rarely across the country. There's a few examples, but it'll be the first, certainly in Southern California, at least in Orange County, for sure. And our patients who now might have to go to the emergency room, which is okay, but they can again come to the 24/7 urgent care to get specialized attention, where the doctors and nurses are specifically focused on the needs of the cancer patients. So it's going to be a real win for really being able to deliver better cancer care.
That sounds wonderful. Do you have an opening date in mind, or
right now it's
schedule?
looking sort of summer to fall 2026, so later in the year.
So
next
just
year,
over
about
a year.
a little over a year from now.
Yeah.
We're really excited about it.
Congratulations, that's
Thank
so
you.
exciting.
Thank you. A lot of stuff.
Well, we're certainly grateful for
Yeah.
doctors like you and all the research that you've done and what you can contribute to the community with the vast array of knowledge that you've gained over the years.
Well, thank you.
We're glad you're in Orange County.
I am so glad to be here. I couldn't be more excited. And thank you for the opportunity to talk to everybody.
Thank you for coming, Dr. Grossman.
Absolutely.
Appreciate it. You're watching This Day on Village TV. We'll be back after these messages.